So the standard process for transplant is patients come in, they get their high dose or modest dose chemotherapy, and then they get their stem cells. And then they live in the hospital on average about a month. So what we've done is we bring the patients to the hospital for their radiation and chemo, but they get to go home either the day before their transplant or the day of their transplant. And they live at home. And so the day is in the morning, an advanced practice provider goes out, examines the patient, takes the history, draws the blood, and then they bring the blood in on their way into work. That blood is analyzed, and we determine whether the patient needs red cells, platelets, potassium, magnesium, what have you. And then one of our clinic nurses goes out in the afternoon and will take that with her to give the patient whatever she needs. And during that time, we have a video call with the patient, with the physician, so we can actually assess how they're doing and get a look at them. So the phase 1 was done. The phase 1 really was to show that it was feasible and safe, and that we did show. We're currently in the phase 2, which is comparing those who are transplanted at home to those who are actually in the hospital, comparing all those outcomes, their microbiome, cost, quality of life, and so forth.